This is Glenn Loury, back again at the Glenn Show at Blogging Heads TV with the distinguished economist Laurence Kotlikoff, professor of economics at Boston University. I myself teach economics at Brown University, but I'm here hosting the Glenn Show, and Larry is our guest. Thanks, Larry. Thanks for joining us at the Glenn Show. Great
to be with you again, Glenn. I guess this is probably our 10th Glenn Show, maybe?
Something like that, yeah. So in fact, it's our second conversation of the day because we began this morning talking about the new Republican administration's thinking and the Congress's on tax policy, which is something you know a little something about. And we had a good conversation on that. People are encouraged to look at it. But we also wanted to talk some about healthcare policy, which is also something you know a fair bit about. And just to set this up, as everybody knows, Donald Trump was elected promising to repeal and replace Obamacare, which he describes as a disaster. In fact, he continues to describe it as a disaster. The Republican Congress have for years, indeed since 2010 when Obamacare was enacted into law, been campaigning with the idea of repealing and replacing Obamacare. Now they've caught up with this. The dog has caught the car, or whatever the right metaphor is. Now the ball is in their court. And what I can make out from reading the newspaper is that they're having a devil of a time coming up with a plan that is not politically disastrous by cutting a lot of people off from health care or taking away some of the benefits that people see in Obamacare, like, not having pre-existing conditions, handicapped people. But this is also something that you've been thinking and writing a lot about. So I was wondering if you could, both give us your sense of what the lay of the land is now. Is Obamacare working? Is it not? What's wrong with it? What needs to be fixed? And your ideas about how you think, as a practical matter, that is politically practical, something that's actually doable, the Congress and the president should be moving on this issue.
Okay, sure. Before Obamacare came into being, we had 50 million people uninsured. 8 million of them were children. So we've had a big problem with people not being covered. A lot of people were seeking care in emergency rooms. It was costing the rest of the population, the rest of people that were employed, higher premiums because the hospitals and doctors were passing the costs on to everybody that did have insurance. So, then President Obama rightfully saw this as a major problem, and Obamacare was put into place. Now, I don't think it was set up the way I would have set it up, but it was certainly much better than what we had. It insured about 30 million people. So we have if I have this right, about 30 million more people insured today than were insured when President Obama took office. And then we still have about 20 million that aren't insured. Now, one of the measures that was trying to keep the exchanges that are a part of the Obamacare system in place was to require that everybody have insurance, so that if you're young and healthy, you had to pay a penalty if you were not covered by an insurance company. This was to induce you to get into the exchanges so that the typical person in the exchange would not be so unhealthy as to cost the insurance company that's providing insurance for the exchanges an arm and a leg.
Yeah, and this is the so-called individual mandate. The so-called individual. Yeah, go ahead.
Right. Employers have to pay a penalty as well if they don't provide health insurance if they had more than, I think, 20 employees. So the idea of pulling everybody together so that the good risks don't free ride on the system and stay out until they get sick and then join, that's critical. And that's just an essential part of any healthcare system that you need to have. Now, what the Republicans so far have done is to undo this individual mandate in the sense of telling the bureaucracies that they don't necessarily have to force it. The IRS doesn't have to start penalizing people or continue penalizing people if they don't have health insurance. they are probably giving a free pass to employers as well. So that's an attempt to undermine Obamacare and have it decline or to destroy it without actually repealing it. So it's letting it try and make it collapse on its own. Now, Obamacare was in trouble to begin with because it's turned out to be more expensive than expected. Fewer people who were healthy joined up than had been hoped. And in many districts and areas, there's just one main insurance company left. For example, if you look at Dallas-Fort Worth, the major remaining insurance company there is Blue Cross Blue Shield. And you can join Obamacare, but you're relegated to two of the worst hospitals in that area, from what I understand. I've been told this by somebody who used to be on Aetna, and then Aetna pulled out and Humana's pulled out of the Obamacare market, I think, across the country. I think United Health has pulled out of Obamacare. So we basically have companies that are selectively selecting into markets where they can make some money and pulling out of markets where they can't. That's not working. So we do need a new healthcare system. And the Republicans have their idea, and I can tell you what that is. I think it's not repeal and replace; it's repeal and destroy.
Well, hold on before we get to that, and that was not exactly a neutral comment, but maybe it's entirely justified. I'll let you try to justify it. But before we get to that, only one insurance company, so that means limited competition. So presumably that means higher premiums for people, and I've been hearing complaints about rising premiums. Employer mandate, so that means incentives for employers to do things to avoid that mandate biting, like, for example, limiting worker hours to being beneath the threshold, or the number of employees in an enterprise to be beneath a threshold that would trigger the mandate. So now, in our previous conversation, you were talking quite a bit about the disincentives to employment associated with tax policy. What about the cost of Obamacare that are manifest in terms of disincentives to companies employing? And what about the cost of Obamacare that are manifest in terms of the falsity of the president's claim that people, if they like their insurance, could keep it, and if they like their doctors, could keep it? That has proven not to be true.
Right. I think Obamacare is a flawed answer, and it's certainly not something I would have pushed. It does have exactly what you're saying, this implication that if I go beyond 19 employees to 20 or beyond 20, all of a sudden I have to provide health insurance, which for a small company, I think it's 20, it might be 50. There's some threshold that can be very expensive and could lead a company not to expand. If you're earning like $30,000 and you're, let's say, the head of a household with 4 people, maybe you're a minimum wage worker, and your spouse is as well. If you earn extra money, you're going to lose 15 cents on the dollar in the Obamacare subsidy. And at some point, you hit some cliffs where you start seeing much higher healthcare costs. So, and that extra tax extends over about a $60,000 range or $50,000 range. So this was not designed by people who thought carefully enough about work incentives. And I fault the designers. I remember having a conversation with Jonathan Gruber, and I don't want to dump on Jonathan Gruber. I think he's dumped enough on himself in his own, some of the statements he's made publicly and got himself into trouble. But he's basically a good guy and a nice guy, and tried to help people. But I remember meeting him in the parking lot after Obamacare was at the NBR. There was a conference at the Sonesta Hotel. And I met him in the parking lot. And I just said, Jonathan, did you look at the implicit tax associated with earning more money under Obamacare? Do you know how big that is?
He didn't know?
He said, he didn't know. I said, you don't know? He said, no, I don't know. How big is it? Well, at the time, I thought it was 25 cents on the dollar. I think it's now actually 15 cents. I got it wrong at the time. But
wow. Larry, let me just tell people out there that Jonathan Gruber, if they don't know, is the economist at MIT who was a main architect of the overall Obamacare policy and who became infamous for being caught on tape at a conference when he thought he was safe because he was amongst other economists, reminding people that sometimes the only way you can get any kind of policy through is by relying on the fact that the people don't really understand how it works. I think he said something about the stupidity of the American voter or something like that, and they've been running that one in a loop on Fox News ever since.
Yeah, and that's an unfortunate thing because he is really a nice guy, a very good economist.
Duly noted.
And his heart's in the right place, but he wasn't paying attention to this essential concern that he should have, I think. Now, here's what the Republicans want to do. I think they want to give everybody a fixed amount of money in a tax credit. So, Glenn, you get a fixed amount of money, I get a fixed amount of money. We take it to our insurance company and say, give us a policy. Now, 1/3 of about 133 million people have pre-existing conditions. So when we go to the insurance company, they're going to ask what kind of health we're in, and they can charge us whatever they want. So it's not going to protect us.
They can't do that now, but you're saying if Obamacare were repealed, they would be able to do that.
Well, I think that they cannot deny coverage to somebody who's already in their system. If they have pre-existing conditions, they probably have to take the voucher or the fixed tax credit. If they become uncovered for a while, then they go back and try and get covered. Maybe they lose their job. They just can't afford paying the out-of-pocket expenses or whatever. They go back in. All of a sudden, they face insurance costs which are unaffordable, and now they're uninsured again. Or the voucher or the tax credit, at least the tax credit that Tom Price, who's the new HHS secretary, the Health and Human Services secretary, the size of that credit that he's advocating appears to me to be so low as to basically provide you with a piece of paper that says you're covered for nothing. In other words, nothing will be covered. You are covered. You have insurance, and the coverage is close to nothing.
Okay, the policy will be very minimal based on the amount of money that's
for super catastrophic illness expenses, but you're going to be on Medicaid anyway at that point. You're going to be on welfare or in the ER claiming. So we're going to be back to a situation where lots of people are dreading getting sick and not going to the doctor because they don't want to hear about being sick, and they can't afford to get annual exams and have things detected early. So it's going to be a terrible situation. What they are talking about is some risk pool that would be somehow done by the states, which would take the bad risk, like in the car insurance area. If you've had enough accidents, you get thrown into a risk pool with other bad drivers, and your premiums are higher. Now that may not work, or they're saying they're going to do that, but I'm not sure that's going to function too well to really deal with the granularity of people that are have pre-existing. What is it going to take to get into the high risk pool, and how many people are going to slip through the cracks and end up facing very high premiums and out-of-pocket expenses because they have these pre-existing conditions. I don't think we should be leaving this up for grabs. So what I'm proposing and have been proposing is called the Purple Health Plan, and it's called purple because purple is the combination of red and blue.
Okay.
And
Larry, I'm sorry to interrupt again, and I want you to talk about the Purple Health Plan, but I want to make sure I understand how you're describing what Tom Price and the Republicans might propose and what's wrong with it. And I think what I heard you say is they want to provide a universal tax credit, but it won't be big enough to get the job done. And they want to supplement that with a kind of high-risk insurance pool for people who have pre-existing conditions. But you're worried that not everybody is going to end up with satisfactory coverage who does indeed have a pre-existing condition under that system. Did I understand that correctly?
Yeah, I think that I'm worried that the credit may be too small. It may not be. We have to give them their due to see what exactly it is. It's just a framework right now.
Okay.
But if Tom Price had his, the credit would definitely be too small. And then I'm worried about they're not dealing seriously with the adverse selection problem in this marketplace. The fact that the insurance companies are making a living out of finding the people that are healthy and trying to insure them and trying to stay away from people that are sick. And so we don't have a plan here that makes a lot of basic economic sense as a solution to the whole set of healthcare problems that we are facing. So let me provide one.
Okay, so again, before you do that, and forgive me, I just want to ask a question. What about the incentive benefits, if any, from having it be people's own money in their hand that they're spending for healthcare rather than a third party paying for it? That would lead them to maybe be more observant and careful about how they use healthcare, or maybe even more diligent about how they take care of themselves to avoid the need for using healthcare. Do you give any credit to the possibility that incentives benefits might come out of the Republican ideas?
Well, I think we have co-pays now for people. We have deductibles. It hasn't put a stop to increases in premiums. I've got a policy at Boston University. The first $6,500 is on me, and I go to the doctor, and they don't really tell me what this thing is going to cost. I just had an injection for tennis elbow just this afternoon. Guy didn't tell me what it was going to cost, but it's going to come out of my pocket. I guess I could have asked him. I'm not sure the doctor knew.
Yeah.
And
I see.
The system. So I do have a plan where I think we get the incentives right.
Okay.
And where we get them right at the
tell us about the purple plan. About the purple plan.
Okay. The purple health plan. Okay. So it's very simple. You take 10% of GDP, which is a big number. That's as much as pretty close to what Germany and France and Switzerland are paying for all their health care in those countries.
That's about what?
We're spending
about 1.7, $1.8 trillion right now?
Yeah, about 1.8 trillion. You take that, that's your budget for giving everybody a uniform basic health insurance plan. Okay. And so by uniform, I mean there's not going to be a silver plan, a gold plan, a platinum plan. Everybody's going to get exactly the same coverages. So Glenn, if your liver gets into trouble, your liver's covered just like my liver's covered. So there's no discrimination on our livers. Okay. So what happens is that everybody gets a voucher, a piece of paper once a year based on their pre-existing conditions. The vouchers depends on your pre-existing condition. So if you're a diabetic, you get a big voucher. If you're healthy, you get a small voucher. And you take.
Okay. So you're going to calibrate the size of the voucher to the level of health of the person.
The expected healthcare cost under the basic plan.
And that's going to be assessed by a physician. There's going to have to be a report or some such audit of health conditions of every person in the society.
Well, there's no incentive really to try and get a bigger voucher because you're going to get the same coverages. It's just the calculation of your expected costs and the size of the voucher will be done by software, by a computer. That's already taking place under Medicare Part C. So we already have the technology in place to do that. So and we're talking about objective factors like blood pressure and whether or not you have got a tumor, or if you had a history of cancer, things of this nature, whether you're diabetic, blood sugar count, measures like this that will be electronically transmitted to a computer. They'll send you the voucher once a year. You get to choose your health insurance company. Could be Aetna, could be Blue Cross, it could be Kaiser Permanente, and then those companies the company you choose cannot turn you down. But they won't want to turn you down because if you're sick, you're going to have a higher voucher that will fully compensate them for your extra expected costs. So they can make money on the diabetic just like they can make money on that perfectly healthy person.
I see.
And then so we're going to have one basic plan, and the insurance companies are then going to be competing to provide this basic plan. It's going to be turned into a commodity, just like wheat. It's going to be a hyper-competitive market because it's the same identical policy. Now, what's covered would be determined by a panel of doctors. You can call that a death panel or a life panel. I don't care what you want to call it, but it's a panel of doctors that would say, look, we have 10% of GDP. If we cover these things, then the cost of all these vouchers will exceed 10% of GDP. So we're going to have to cut back some of these coverages, and we're going to make that decision. So we end up with exactly the vouchers adding up to 10% of GDP.
Can I just ask you where that 1.78 trillion is going to come from? Who's going to be paying the taxes that underwrites the cost of that?
Well, we're going to have we're going to have tax reform. We can talk about, my tax reform. We talked this morning about the House Ways and Means Committee Republicans' tax reform. I think I have a better plan, but I think their plan is pretty good, as we were talking about.
We were mostly talking about the corporate income tax being changed, but you're saying that you'd roll healthcare into general tax revenues and pay for it in that way.
We need to have, there's the spending, and we need to have the tax side right and the spending right. We need to fix Social Security, healthcare, and the tax system and the welfare system all together. And at Kotlikoff.net, which is my website, there's a book called "You're Hired!" ! Mark, a Trump playbook for fixing America's economy. Anybody can go there at Kotlikoff.net, download it for free, and send it to their members of Congress, because these guys seem to be slightly lost as to what to do, except maybe on the tax side, they have a pretty good plan coming out of the House. Needs some tweaks, but they have no idea about how to deal with Social Security, the healthcare we've talked about. So anyway, once a year you're going to get this voucher. You're going to choose your health insurance plan. You can buy a supplemental policy that gives you coverages beyond what's covered. So we're talking of the coverages here would include things like cancer treatment, things like nursing home care, drugs, and I'm talking about one plan for everybody in the country. So I'm talking about getting rid of Medicare, Medicaid, Obamacare, and employer-based health care. We do not have to have our employers determining our health care. Does that make any sense as an economist to you, Glenn? Should our employers be deciding how much we get to save on a tax-free basis through our 401k, how we should be able to invest our money, what insurance policies we should have access to? When did our employers become our parents or our grandparents, as opposed to just our bosses? They should be entirely out of this business.
Now, my understanding is that historically that comes about because of wage and price controls during the Second World War, and of employers not having any way to compete for workers except through a non-pecuniary compensation. And so they began to offer benefits like health coverage as a part of their compensation plans as a way of indirectly raising wages for workers. Is that right?
I think that was it. I think the unions, I think older managers set up, if you look at defined benefit pensions, they set up these plans in a very backloaded way to help themselves to a very fat retirement, because they were very close to retirement. And the formulas were set up to overcompensate older workers who had long service, and to leave a big bill for future workers, and to underfund these pensions, because the accountants and the actuaries joined forces with the management and the older union workers to run a Ponzi scheme. That's why we've seen almost every major U.S. corporation renege on its pension plans by transforming them into cash value plans. And starting with IBM, they did this incredible swindle. They promised workers these great pensions if they just stayed on the job. They got them to work on that promise, and then they turned around and reneged on it and said, "Oh, we've changed our pension plan. You're now on this other cash value plan." The state and local governments, look at Illinois; they're 60% underfinanced.
Yeah.
Look at Detroit. You've got firemen and policemen who risked their lives, retired. I think they had to take a 6% cut in their pay, in their pension. But in addition, their pensions are not inflation indexed anymore. So this could be a major disaster for them as they continue to live through time. So this is malfeasance. This people in the pension industry and the pension management of these plans, the people in the actuarial industry, in the accounting industry, they should be put in jail for what they've done to the state and local pensions and the private sector as well. There's really, I think, it was a Ponzi scheme that worked for some people and then other people got hurt. So,
okay, but coming back to the health, you're saying one policy for everybody, and you're saying you're rolling in Medicaid, Medicare. We're eliminating employer-based health coverage for everybody. Everybody's going to be a part of this system in your vision.
Yeah, so all the money we're spending now on Medicaid, Medicare, the tax subsidy to employer-based health care, and Obamacare and child health care, all those funds, which come to about 7% of GDP, would be used to come up with a 10%. So part of this spending is just replacement spending.
Now, I just want to ask you one more thing quickly, which is 10% is a lot less than 17% or some number like that, which is what I hear currently of GDP is what's going to healthcare. So that sounds like a significant cut in resources flowing into the healthcare sector.
Well, again, there'll be supplemental policies for the rich who can afford to buy a coverage for their angioplasty at 95. Yeah. But other countries are able to, here's the other thing, Glenn. Think about the incentives of this system. Kaiser Permanente, I think over time, the system would evolve into HMOs, health maintenance organizations. One of them, in the case of Kaiser, they have hired the doctors. They have built the hospitals or purchased the hospitals. So all the costs devolve onto Kaiser for extra care. The doctors on fixed salaries. So if their doctors start over-treating people or over-MRIing them, they're going to be fired and they're going to hear from the management. On the other hand, if they under-treat people, Kaiser won't have any patients coming back next year, and they'll lose money because the vast is going to have a profit margin. So I think we're going to internalize the incentives the correct way, so that we don't have to have the patients figure out how much of the healthcare system they should be using on their own. And all kinds of waste that's happening here should disappear through time. Let me just give you an example of something absolute. My mom has she's 97, God bless her. She has a narrow airway, and so she moved from Ithaca, where she was staying near my brother when he became provost at Cornell, to come to live across the street from me. And my mom quite well. She's
Vivian, this is this wonderful old lady. Everyone should know her. She's just a jewel. She's precious. 97, did you say? She could easily pass. She could easily pass for 85.
Okay. So she has this aspiration problem.
And you can tell her I said so.
3 weeks before I brought her to Boston, she had to have an X-ray test with a speech therapist in Ithaca, the Cornell Hospital there. Not the Cornell Hospital, there's a local hospital. And then we brought her to Mount Auburn to see her new GP, who then sends her to the speech therapist, who says, let's have the X-ray. I said, well, it was just done 3 weeks ago. Haven't they sent you her results? Because we'd asked the hospital to fax them over several times in the course of a week, never arrived. They did the test from scratch again, another couple $1,000 test. This, we all know that money is going out the wazoo because nobody's paying. Well, here, the healthcare system is going to get a fixed amount of money from the government, 10% of GDP, and that's it. Nothing more at the margin. And now they're on the hook for every penny that they waste. So I think that about 25% of our 18% of GDP expenditure is just total waste. And that problem will, that we will get to a situation like they see in France or Switzerland or Germany, where 11, 12%, 10% of GDP is spent on healthcare, and they have at least as good a set of outcomes as we have, if not better. Now, I think our society is somewhat sicker than their societies, because somehow the French, they can eat brie and not get fat.
It's about how much you eat, Larry. They don't eat that much brie.
Okay, maybe that's it.
Yeah, and they eat 6-ounce steaks instead of 16-ounce steaks, and so forth.
But the real beauty of this is we keep the spending at 10% of GDP through time. Right now, we're on a course, according to the CBO, of spending closer to 20 or 25% of GDP on healthcare at the government level through time, the projections. Now, that will completely bankrupt our children. So when you look at the long-term fiscal picture, all these off-the-book debts, obligations to take care of the current 177 million baby boomers who are the oldest ones just reached 70.
Yeah.
That whole expense is right there as a unfunded liability, off-the-books debt. Same with the Social Security benefits these folks are being promised. And Social Security is 32% underfinanced. The entire fiscal operation is $206 trillion in the hole. That's our fiscal gap. We're 53% underfinanced. We need a immediate and permanent hike of 53% in every single tax rate to pay for the spending under the course of policy that we now have in place. So we have to fix these programs in a real serious way. But just leaving it to saying, well, look, if you're healthy, we're going to take care of you. If you're unhealthy, well, it's your problem. Or you should have taken better care of yourself. Let's blame it on the victim. That's not an answer that's going to rest well with the American public. I would be very concerned if I was a Republican legislator, member of Congress, about putting 50 million people into jeopardy.
Of course.
Like they were before President Obama took office.
Let me just ask you about the politics of your plan. Purple plan, it's got red and blue aspects. Thing is, however, these seniors currently being protected by Medicare are not going to go quietly into that good night. They're not going to, are they, sit by while you roll them into a general and universal system, which inevitably will be less beneficial for them than their current situation.
Well, I think it's required. I think we're going to have people realize that everybody in this country, regardless of their age, deserves basic health insurance, and we shouldn't be treating a 75-year-old better than a 3-year-old. We just shouldn't. And we've been catering to the elderly to get their votes. That's what's been going on in Congress, because when it comes to election day, the elderly have nothing better to do than to vote. The rest of us are basically working, or we're too young to vote, or we're not yet born. But we're being delivered. If we're not yet born, we're being promised these huge bills that we have to pay for as soon as we show up and get into the workforce. So we have to talk to older people and explain to them that we're doing this to help their children and grandchildren. That's supposed to be the most important thing in their lives. I think I could explain to older people that we're going to get into a boat with everybody else together, and one provider but multiple providers but one payer, and the one payer is the entire country, because it's really multiple payers too, because we're all paying through our taxes. So we're going to have an efficient, what I would do is have an efficient tax system. It'd be different from the House plan, but it's not that much different. But an efficient tax system that gives everybody good incentives to work, and it should not be the case that if I earn more money, I lose my Medicaid, and I lose $10,000 worth of health care benefits from Medicaid for myself and my family, or maybe $15,000 because I earned an extra penny or dollar. And that's the way Medicaid now works. It shouldn't be that I earn another dollar, lose 15 more cents from Obamacare subsidies. I lose those subsidies when I'm already paying, wage taxes, payroll taxes, state income taxes, sales taxes.
Yeah.
I could lose 22 cents in EITC, the Earned Income Tax Credit. I can lose 23 cents in food stamps. If you add all these marginal taxes together, they get astronomical. We just need to have people that actually think about staying within a budget and also the incentives. We need economic engineers to fix the system. We can't have just people that are really speaking, from a different planet about the healthcare. You have Tom Price, who thinks maybe health insurance isn't necessary. Everybody should just take care of themselves and eat well. I've gotten emails from people. I wrote about this plan in column that I write, a syndicated column that just started coming out, and it came out in the Dallas Morning News, the Austin Statesman, and other places around the country, Seattle. I got about 100 emails about this plan. A lot of them were very angry. I take care of myself. I'm in good health. And why should I pay anybody else? Well, tomorrow they could get run over by a truck and need everybody else to help them, because that's what insurance is. The other thing I want to say here, Glenn, I don't want to take too much of your time, but if you're my brother or my friend and you are my close friend and you're not insured, well, I'm not insured either. Even though I've got good insurance at Boston University, if you're not insured, I'm not insured because I care about you, and if you need money, I'll have to hand it over to you. So where did I learn that lesson from? I learned that lesson from Sandra Day O'Connor, the former Supreme Court Justice. So Sandra and I were both speaking on a panel down in Washington at a conference, and in the break, she and I started talking, and she had talked about the fact that her son was not able to get health insurance. This is after she stepped down from being Supreme Court Justice. She retired. So within a few months, she was giving this talk about why is it that in our country we don't have health insurance for everybody? Because my son, who's in good health, can't get health insurance, and he's in his 30s. And then I talked to her and I said, why can't he get health insurance if he's in okay health? She said because he has a child who has a pre-existing condition, and therefore Sandra Day. And then we discussed it, and I said, well, that means you're not insured either.
Right.
And she says, you're absolutely right, because my grandchild, if my grandchild needs help, I'm going to have to come up with the money. So this idea that somehow it's those people and the rest of us are okay, those people are relatives and our friends and our countrymen and countrywomen. We have to be in this together in the same boat. So that's what I would say to the elderly and to every group that feels that they are somehow privileged, including employees who think, well, I've got a great plan. Why should I change it?
Sure.
Yeah.
Okay.
Well, you've got a great plan because you've been healthy.
No, that's right on. I think that's an appropriate note on which to end this short conversation. Purple Plan, Kotlikoff.net. The book is called You're Hired, which is no doubt a turn on Trump's You're Fired from The Apprentice. And he ought to hire you, Larry. I think I've said it before. I don't know that you need the grief of working for Donald Trump, but we certainly need the benefit of your expertise.
Well, if you called, I'd be happy to help him, but I wouldn't take any crap. That's the thing. I've dealt with people that think they're smarter than God. Nobody's smarter than God.
Yeah.
And you just tell it the way it is, or you get fired. If you get fired, you get fired, but you don't lie. That's my message to anybody who goes to Washington.
Very good, Larry. Thanks again, and we'll talk again soon.
My pleasure. Take care.